Hey, welcome. This is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center here in Rocky Mount. And this is a community-sponsored organization by you, for you, and about you. So we are always talking about something good for you, learning how to take good care of your health. You know, nobody is going to take care of you the way you will. Doctors can do the best they can, but seriously, you have got to grab hold of your own health and do as much good as you can. And so I'm going to talk tonight about the complications of diabetes, how diabetes affects every one of our organs. And it's really a terrible disease, and you know, it can lead to hemodialysis because your kidneys no longer function. That's something we'll talk about a little bit later. It can talk to amputations because your body is not getting the circulation it needs in what we call the periphery, and the periphery is the hands and feet, the parts of your body that are farthest from your core and farthest from your heart. And so, you know, if the body has to make a choice of where to send blood, it's going to send it to your heart and your lungs and your fingers and toes. You can live without those, and you know, your legs and hands and that kind of thing. So that's why that happens to us. I'm live tonight. I'm here alone, so I'd love to have somebody call me, 407-1111. So I'm just going to get on into it. And, you know, I'm always talking about taking care of yourself, eating right, exercising. And I finally got myself back on my elliptical. I had every excuse in the book not to get on it, and I started last week, and I've worked my way up to 15 minutes. My goal is 30, so I'm not quite there yet, but I can tell you I'm sleeping better, I feel better, I have more energy just on those few extra minutes. I'm getting up 15 minutes early. I sit and read my Bible and do my devotion, and then I go. My elliptical is on my screened-in porch, so I go out there. It's still pitch black. I look at the pretty lights I have around our patio and things like that, and sometimes I pray, sometimes I just sit there. I mean, well, I'm working, but you know, I don't. My husband's going to make me a holder so I can hold a book so I can read in the mornings after, so I'm on the elliptical. That makes it easier to get through the 15 to 30 minutes that you do. So exercise is really, really an important part of what we do. So complications of diabetes, it can affect, it affects every organ that we have. And high blood sugar, that's the hallmark of diabetes. If you have high blood sugar, you have diabetes. But it does not cause most of the morbidity or the harm of the disease. Your glucose can be managed quite well with, you know, all the medicines we have, and there are even some medicines out there that help you lose some weight. But this does not prevent the long-term complications, which is very sad. You think, oh, my diabetes is controlled, you know, I'll be just fine, but that hopefully that's the case, but it may not be. Despite blood glucose control, damage happens to about every organ of our body. These complications are generally classified as microvascular, which would be small vessels, and macrovascular, which would be large vessels. So tips of fingers has small little blood vessels in them. Our heart gets fed by large blood vessels. That's kind of the difference between. Certain organs, such as eyes, kidneys, and nerves, are predominantly perfused by small blood vessels. And chronic damage to these small blood vessels causes failure to these organs. Damage to larger blood vessels results in narrowing called atherosclerotic plaque. When this plaque ruptures, it triggers an inflammatory reaction and blood clots that cause heart attacks and strokes. When blood flow is impaired to the legs, it may cause gangrene due to reduced circulation. You can also get atherosclerotic plaque in your legs, and that's called peripheral artery disease. Remember, our legs and arms and feet and hands are the periphery, and that means that you've got arterial disease, just like you can have a clogged artery in your carotid going into your brain. Well, these are in your legs, and that can cause a lot of pain, something called claudication, that you can't even walk, you know, to the mailbox and back without your legs hurting so bad you have to rest. You'll have to excuse me, this pollen, I felt it coming when I was driving here. There's a lot of pine trees around Wesleyan College where I am, and I could just feel it in my throat. So I've got my water here, and I might just have to take a sip every now and then. So please forgive me for that. But we don't have as much pollen where I live, because I do have pine trees, and I do have some pine pollen, but nothing like in Rocky Mount where I work and here. But anyway, and then there are other complications into this categorization. We talked about the larger blood vessels, the smaller blood vessels, the atherosclerotic plaque. A variety of diabetic complications are not obviously caused by injured blood vessels. That would include skin conditions, fatty liver disease, infections, polycystic ovarian syndromes, Alzheimer's disease, and cancer. So see, it kind of spreads over the whole gamut of the diseases that we have in our country and in our bodies. So we're going to talk about the microvascular conditions first. That's the small little blood vessels. And then there's a word called retinopathy, and that's disease in your retina. I should have Dr. Robertson here. He's the eye doctor. He can tell us all about that. But diabetes is one of the leading cause of new cases of blindness in the United States. That was according to the CDC in 2011. So the eye disease, characteristically retinal damage or retinopathy, is one of the most frequent complications of diabetes. The retina is the light-sensitive nerve layer at the back of the eye that sends its picture to the brain. Long-standing diabetes weakens the small blood vessels in the back of the eye. Blood and other fluids leak out into the eye, causing damage. That's why your doctor is going to tell you to go and get a diabetic eye exam once a year, because your eye doctor is going to dilate your eye, and he's going to look in the back of your eye to see if there's any damage from the diabetes. And if there is, then we're going to have to make sure that A1C is lowered, that your fasting blood sugars are lowered, that you're not spiking up blood sugars after you eat. You might have to take some mealtime coverage of some insulin or some kind of a pill to cover that, to keep your blood sugar. We want your blood sugar to be as steady as possible. We don't want to get in big spikes going high, and we don't want to get in drops of low. We want it to keep it steady as much as possible. If you eat sugar now, you eat a honey bun, and at first you feel great. Boy, it just kind of fills you up and gives you a little energy, and you're ready to go. But then, because you're going up, your sugar's going up. But then if you don't have something in your bloodstream, that you haven't eaten something else, such as some kind of a protein, you're going to plummet down. And when you plummet down, you feel bad. You can feel nervous, jittery, shaky, irritable, and that is just something that we do not need to have happen to us. So the retina is one of the blood vessels that can be directly visualized, and then it can be, your doctor can say, your eye doctor will tell you, well, you need to do this and this and this to get that blood sugar down, to get those eyes, better. And to be honest with you, I don't know what kind of medicines the ophthalmologists have for diabetic eye disease. Like I said, I should have Dr. Robertson here with me. And if you're watching, Tom, you got to help me out here. Over time, new blood vessels will begin to form in the retina, but these are very fragile and they tend to break. The proliferation of new blood vessels can lead to more bleeding inside the eye, called a vitreous hemorrhage, or it can form scar tissue. In severe cases, the scar tissue can lift the retina and pull it away from its normal position. The detachment of the retina, or you've heard the term retinal detachment, may lead to eventual blindness. Lasers are often used to prevent the formation of these new blood vessels. Another reason to get your eye exam on a regular basis, because a lot can happen in a year. And the older we get, the more that can happen. So I'm here to tell you, because I keep getting older. It's amazing. In my brain, I feel like I'm about 25. Got lots of energy, lots of ideas, want to do things. But then when I get out and do some of them, especially if I'm going to scoop some manure out of the goat pen, or, do something with the dogs, then my body says, wait a minute, sister, you're not 25 anymore. I'm sure you've all experienced that yourselves. So approximately 10,000 new cases of blindness each year are caused by diabetic retinopathy. And the development of the retinopathy depends upon the duration of the diabetes, how long have you had it, as well as the severity of the disease. In type 1 diabetes, the majority of patients will have some degree of retinopathy within 20 years. In type 2 diabetes, retinopathy may actually develop up to 7 years prior to the diagnosis of diabetes itself. And that's one of the problems with diabetes, is that a lot of us are walking around and we're pre-diabetic or already diabetic and don't realize it. So that's why it's really important. I say at about age 35, you really need to get a yearly physical, no later than age 40, and get some blood work once a year. And if your doctor tells you you're pre-diabetic, that is the opportunity for you to jump on the bandwagon, eat better, exercise more, find out what you can do to control the diabetes, and do it, because you do not want to become a diabetic. All right, so we're going to move on to the kidney. What does diabetes do to the kidney? A diabetic kidney disease called nephropathy is the leading cause of end-stage renal failure, called ESRD, in the United States, accounting for 44% of all the new cases. End-stage renal disease is defined as kidney failure requiring dialysis or transplantation, but many are diagnosed with lesser degrees of chronic kidney disease. In the United States, more than 100,000 patients are diagnosed with chronic kidney disease annually. In 2005, it was estimated that the care for kidney disease costs the United States $32 billion. I bet it's more than that. The cost of this burden is enormous, both financial and in emotional terms. If you have diabetes and it affects your kidneys, going to dialysis will keep you alive, and then, of course, we want that. But people with end-stage renal disease a lot of times are very miserable people because the poisons come out through the pores of their skin and they're always itching and they're miserable. They don't have any energy. They're absolutely zapped after they have their dialysis intervention. You know, you sit in the chair for 4 hours and the blood is pulled out of your body, goes through this artificial kidney, which is a big machine, and then it's put back in your body. And that takes a lot out of you. So one of the kidney's major functions is to clean the blood of various toxins. And as the kidney starts to fail, toxins build up in the blood, causing loss of appetite, weight loss, persistent nausea and vomiting, and eventually coma and death if untreated. Dialysis, we talked about, is the artificial procedure to remove the accumulated toxins in the blood. It is only used when the kidneys has lost over 90% of their function. The most common form of dialysis is hemodialysis, and you know, all you have to do is ride around Rocky Mount and you're going to see lots of hemodialysis center. Where I work, there's one right next door and one right across the street, 2 different companies. And that's when dialysis, as I said, removes your blood, cleans it, and puts it back. Patients typically undergo dialysis 3 times a week for 4 hours each. A diabetic kidney often takes 15 to 25 years to develop. So if you're diagnosed with diabetes today and don't take care of yourself, you can count on 15 years down the road having to go to dialysis. And nephropathy, like retinopathy, so nephropathy is the kidney, retinopathy is the eye, may actually present before the diagnosis of type 2 diabetes is made. The first detectable sign is finding trace amounts of leaked protein called albumin in the urine. And this stage is called microalbuminuria. And approximately 2% of type 2 patients develop this each year. And in 10 years, it goes up to 25%. And the amount of leaked albumin continues to increase over your years, and eventually the kidney doesn't clean and remove the toxins as well as it should, and you have to go on to dialysis. So we're going to stop right now. It's almost time for a break, so we'll go a little bit early. And when we come back, we're going to talk about neuropathy. That's damage to your nerves. So don't go away, and we'll be right back after these messages, and we'll talk more about the complications of diabetes and how it affects every one of our organs. Don't go away. We'll be right back.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Cuss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, welcome back. Hello, this is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and we are talking about the complications of diabetes, a disease that affects all of your organs. So we've talked about retinopathy, which is disease to your eyes. We've talked about nephropathy, which is disease to your kidneys. Now we're talking about neuropathy, which is diabetic nerve damage. And that affects 60 to 70% of people with diabetes. There are many types of diabetic nerve damage. Once again, the duration and severity of diabetes correlates with the occurrence of neuropathy. The most common type of diabetic neuropathy affects the peripheral nerves. Here we go with the periphery again, you know, the arms and the legs. That if you missed the first segment, the periphery is what's going to be affected first, because the body knows to protect the internal organs, and it knows to protect our heart. And so they will shunt all of the blood needed to keep our internal organs going and block the blood off of your periphery, your arms and legs. And that's why you'll see some people have gangrene because they don't have circulation to their fingers, or they've had to have a foot amputated, a toe amputated, a finger amputated. And so, now where was I? Oh yes, neuropathy affects the peripheral nerves. And the feet are affected first, and then progressively the hands, arms, as well as characteristic stocking and glove distribution, meaning up your feet up to your lower legs, and gloves on your hands. And the symptoms include tingling, numbness, burning, and pain. The one I hear most common is burning and pain. Symptoms are often worse at night, and the incessant pain of diabetic neuropathy is often one of the most debilitating aspects of this disease. Even powerful painkillers such as narcotic medications are often ineffective. And we all know what too many narcotics does, and how we develop the opioid crisis because of doctors giving out too much pain medicine. You feel for these people when they come into your office. They're hurting. They're crying sometimes. They hurt so bad. But, sometimes our hands are just tied and we can't do much for the pain. But lack of symptoms doesn't mean that you don't have some nerve damage. The pain, rather than pain, patients might experience complete numbness with no sensation at all noted in the affected areas. Careful physical examination reveals decreased sensations of touch, vibration, temperature, and loss of reflexes. And I'll tell you a little story about one of my friends who did not take care of himself with his diabetes like he should have. And I've known him about 5 years, and I don't think he's ever had feeling in his feet in all those years, the majority of them anyway. And he had stepped on I think it was a staple. Anyway, he had something stuck in his foot. He didn't know it. Who knows how long it was there. And he was sitting on the couch with his feet up on the ottoman, and his wife walked by and saw a red spot on his foot and said, "I think you got something in your foot." So she went and looked, and it was that staple, and she pulled it out. Well, he ended up in the hospital for 5 or 7 days getting IV antibiotics to preserve that foot so they didn't have to take it. So, you know, when we say it's numb, it's numb. So you've got to really, that's why when you have diabetes, doctors are always looking at your feet or always asking you about your feet, because you can have things like that staple in the bottom of your foot, and you don't know it, and then that causes a problem. So while the loss of sensation seems kind of innocuous, it is anything but. Pain protects against damaging trauma. Charcot foot is the progressive deformation caused by repeated trauma. When most people would sensibly adjust their position when their feet started to hurt, diabetics don't feel these damaging episodes, and so repeated over the years, destruction of the joints ensue in your feet. Carpal tunnel syndrome, caused by compression of the median nerve as it runs through the wrist, is a common ailment. In one study, 80% of those with carpal tunnel had insulin resistance. Large muscle groups may also be affected in diabetic amyotrophy. I can't read all these words, you know, guys, I'm not that good at it. I'm a common girl. Characterized by severe pain, muscle weakness of the thighs. The autonomic nervous system controls our body functions that are generally not under conscious control, like your breathing. You just breathe. You don't think about it. You don't make yourself breathe. You just breathe. So it's breathing, digestion, sweating, heart rate. These nerves can also be damaged, causing nausea, vomiting, constipation, diarrhea, anhidrosis, which is lack of sweating, bladder dysfunction, erectile dysfunction, orthostatic hypotension, which is a sudden severe drop of blood pressure on standing. If cardiac innervation is affected, the risk of silent heart attacks and death is increased. And you've heard the term silent heart attack, and that's a lot of times because the heart is the nerves are gone from the heart because of the diabetes, and so you have a heart attack, you don't feel it. There is no real treatment to reverse the diabetic nerve damage. Some drugs can help with the symptoms of the disease, but it does not change the history of what's going on, and ultimately the only way you can take care of it is to prevent it in the first place. All right, so those are some of the microvascular disease. Now we're going to move into some of the macrovascular diseases. So atherosclerosis, that's a big fancy word, and that's a disease of the arteries whereby plaques of fatty material become deposited within the inner walls of a blood vessel. This causes narrowing and hardening of the arteries of all sizes. Diabetes greatly increases the risk of developing atherosclerosis. Atherosclerosis of the large blood vessels of the heart, brain, and legs are the standard cause of heart attacks, strokes, and peripheral vascular disease, respectively. Another one that causes this is smoking. So if you got to start your prevention tonight and you smoke, stop doing that. Together, these diseases are known as cardiovascular diseases and are the main cause of death for diabetics. And you know, there's a lot of new, well, not even new, but there's a lot of standard diabetic medicines that are continuing to be studied and now have been shown to have increased cardiovascular protection, that particular drugs will help protect your heart. So when your doctor says, well, we need to put you on this Farxiga, it's a little expensive, but think about this, because I know it's expensive and I know we got to protect our pocketbooks. I get all that. But if we don't protect your heart, you're not going to have a pocketbook to protect. So, you know, you got to look at it in those terms as well. The amount of death and disability resulting from cardiovascular disease is an order of magnitude much greater than from the microvascular disease. So in other words, your chances of having a heart attack are going to be higher than your chances of diabetic retinopathy. But you can get it all, so don't you know, choose one for another one. Let's see, we're talking about cardiovascular disease from the microvascular disease. It is popularly imagined as cholesterol slowly clogging the arteries, much as sludge would build up in a pipe. However, that theory isn't true anymore, and that they don't think that anymore. They know now that atherosclerosis results from the injury to the endothelial lining, the inside lining of the artery. It allows infiltration of cholesterol particles into the lining of the artery wall, which causes inflammation. Smooth muscle proliferates and collagen accumulates in response to this injury, but this only further narrows the vessel. So, you know, if you're diabetic, even if your cholesterol is not high, your doctor's going to want to put you on a statin. That's the cholesterol medicine. Why? To help prevent cardiovascular disease. So, you know, when your doctor says, you know, you need to take this one, you need to take this one, a lot of people bawl. No, my cholesterol's fine, I'm not going to do it. Well, that's not, it's not just to keep, you know, to lower cholesterol. It's to protect those blood vessels from getting clogged up and from the plaque breaking off and going into your brain and giving you a stroke, or going into your heart and giving you a heart attack. So, you know, that there's a great picture here of how that all works, but it's kind of, I can't show it to you. I don't know how to do that. But, you know, there's another test called NMR, and a lot of doctors want to use that to determine, as I'd said, there are particles of cholesterol. There's big particles and little particles. The little particles tend to go right through and we don't have to worry about it. It's the big particles that stick to and adhere to the inside of the vessel. So this particular test, and some insurances, I'll tell you, won't pay for it. It's expensive. But that will show you your particle size. So if you've got big particles, even though, and it can really be much different than your standard lipid panel, your standard cholesterol panel. If you've got large particles, you've got to get them down, because that is what's going to help prevent that heart attack from coming. So, you know, I know a lot of people say, well, they just want to do that to make money, or they probably have some kickback from that test. Well, other people might. I don't know. I can just tell you I don't. I try my best to take care of people the way I know how, and by what's based by, you know, the science and the studies and that kind of thing. I would hope that there's no doctors that take kickbacks, but I'm sure there probably is. I don't know. I don't want to go into that. I'm just saying that most docs, we're here to help you. We're here to make you feel better. We're here to take care of you. We're not here to strip your pocketbook. And I will tell you that I have a lot of people that I go directly to the drug company and get their medicines. They don't have insurance, or they're underinsured. They can't afford, because most diabetic medicines are very expensive. You've got a couple that are generic and they don't cost much, but the rest of them are cha-ching, cha-ching. So I will contact the particular drug company that makes a drug and say, you know, Linda Prezioso doesn't have the money. This is her problem. This is her diagnosis. And most drug companies have patient assistance programs that will help you get their product. So if your doctor says it's expensive, ask them, well, how about this patient assistance program? Can you help me with that? I don't know if other people do it. I just know I do it. All right. So we'll go into heart disease. That's certainly a large blood vessel. And it's, you know, heart disease is the most well-recognized and feared complication of diabetes. The presence of diabetes increases the risk of cardiovascular disease 2 to 4 times higher than someone without diabetes. Complications develop at a younger age. According to the American Heart Association, at least 68% of diabetics aged 65 or older will die of heart disease, compared to 16% who will die of a stroke. Because more than 80% of the diabetics will die of one cardiovascular disease or another. Reducing macrovascular disease is of primary importance, even above those of the microvascular concerns. That's why I'm pushing you to see your doctor, and if he's pushing a particular drug that's very expensive, ask him why, ask him what it does, and then let him explain to you how important it is for, you know, the blood to flow the way it's supposed to your heart. The Framingham studies of the 70s established a firm foundation between heart disease and diabetes. The risk is so high that diabetes is considered the equivalent of having had a previous heart attack. Diabetic patients have over 3 times the risk of heart attack of those to non-diabetics. Over the past 3 decades, there have been significant improvements in treatment, but the gains for diabetic patients have far lagged behind, and that's why there's some new diabetic drugs that are now being studied, and some have shown they are able to help the cardiovascular system. And so, you know, like if your doctor says, I want to put you on this, listen to him and talk to him and see if you can't somehow get it in your body so that you can be the healthiest you can be. So the death rate for diabetic men has decreased by 36%. It's only decreased 13% for diabetic men. In diabetic women, death rate decreased by, non-diabetic women, death rate decreased by 27%, but increased 23% for diabetic women. So non-diabetic women are going down and diabetic women go up for the death rate, and we don't want that either. All right, when we come back, We'll take our next break, and when we come back, we will talk about stroke and how diabetes plays a part in stroke and what we can do to prevent that. Don't go away. We'll be right back. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports, to compression hose, to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey, welcome back. This is Here's to Your Good Health. I'm Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and we have been talking about the complications of diabetes, a disease that affects all of our organs. So we've talked about heart, and now we're moving into stroke. The devastating impact of stroke cannot be underestimated. In the United States, it's the 3rd leading cause of death and the biggest contributor to disability. Diabetes is a strong independent risk factor in stroke, increasing risk by as much as 150 to 400%. It is estimated that approximately 1/4 of all new strokes occur in diabetic patients. The risk of stroke raises 3% every year for if you're diabetic. The prognosis of stroke is much worse in diabetic patients than in non-diabetic patients. And you know, I know you've all seen people walking and they're kind of holding one hand funny, or they're dragging a foot, things like that, because they've had a stroke. You can recognize somebody that's had a stroke by the gait, or you can recognize somebody who's had a stroke by their speech. They might not be able to speak as clearly as they did before, or they might have to really speak deliberately to be able to get the words from up here out their mouth, because the stroke has impaired their brain at some point. I can't tell you how, when I worked in case management at the hospital, how many young people, they'd have a stroke, and then they'd get a feeding tube, and then they'd go to the nursing home and they'd lay there, and then they'd get bed sores, because no matter what you do, you just can't turn people enough, and you just can't tend to them enough and take care of them enough to stop some of these horrible diseases when you're just laying in the bed. And so it's really debilitating, and it can affect your speech, it can affect your swallowing. You may not be able to swallow food, and so you have to have a feeding tube. It can affect the way you think. Some people that have strokes and have damage to their brain, they laugh inappropriately. They laugh when it certainly isn't funny, but their emotions are all garbled up because of the stroke. So strokes are, none of this is any joke, but to me, I think a stroke is more debilitating than the heart attack. Now you can be short of breath with the heart attack, and you can be so weak you can barely do anything after a bad heart attack. I know that. But heart attacks normally don't take away your speech, and don't take away your ability to walk, and don't take away your ability to swallow. But none of it's good. So let's just prevent it all and not pick and choose which one we're going to have if we're going to have one. Let's just not have anything at all. So now we're going to move into peripheral vascular disease. We've talked about the periphery, your arms and your legs. And peripheral vascular disease is caused by the blockage of blood vessels going to the lower extremities. It may happen in the arms or hands or arms too, but that's not very common. The progressive narrowing of the blood vessels starves the leg of the much needed oxygen. Of the much needed oxygen carrying hemoglobin, and hemoglobin is part of our blood that our blood needs it feeds our body. Intermittent claudication, or pain and cramping that appears with walking and relieved by rest, is the most common symptom. As circulation worsens, pain may appear at rest and is especially common at night. Diabetic foot ulcers may occur and progress to gangrene in severe cases. At this point, amputation is often necessary. If you've got gangrene, you've gone down a path where there's no return. So diabetes, along with smoking, are the strongest risk factors for PVD, peripheral vascular disease. Over a 5-year period, approximately 20% of patients will have progressive disease, and amputation will occur in 4% of those patients. Peripheral vascular disease significantly reduces mobility, leading to long-term disability. Intermittent claudication results in reduced mobility. Patients with gangrene and those requiring amputation may never walk again. This may result in a cycle of disability with progressive deconditioning of muscles. Severe, unrelenting pain impairs the quality of life. So PVD is another one, that peripheral vascular disease is just another complication, and diabetes can just affect all these, and so we need to really eat right, exercise, move, and take care of ourselves. You know, we can increase all of these risks and increase all of these problems by drinking too much, smoking, eating too much, not eating healthy food. You know, the food industry has taken most of the nutrition out of the food that they prepare for you. The boxed foods, the canned foods, the cellophaned foods. And they've replaced it with sugar, fat, and salt. And so, you know, you have to cook fresh every day, or, you know, the majority of time. I mean, I ate Mexican last night. I'm not such a diehard that you've got to, you know. But tonight we had beef stew, which is something I made over the weekend with, you know, fresh potatoes and carrots. And we get our beef. I contract with somebody who raises steers, and I buy a quarter of a steer once a year, and my steer is going to be ready in a few weeks. I still got a little bit from last year's steer I got to get rid of, but because I believe in grass-fed beef, I don't want any of the hormones. I don't want any of the junk that they feed animals so they'll fatten up before they go to the butcher. None of that's good for us. That's not the way God made us. That's not the way God wanted us to eat. So anyway, let me get off that bandwagon. You know, I can go on forever. So there's other complications as well. Cancer. Many common cancers are related to diabetes and obesity. It includes breast, stomach, colorectal, kidney, and endometrial cancers. This may be related to some of the medications used to treat diabetes. And survival of cancer patients with pre-existing diabetes is far worse than those that have no diabetes. Skin and nails. Type 2 diabetics frequently will have some kind of a skin disease. Acanthosis nigrans is a gray, black, velvety thickening of the skin, particularly around the neck and in the body folds. High insulin levels stimulate the growth of the keratinocytes to produce the thickened skin. Nail problems are common in diabetics, especially fungal infections. Nails become discolored to a yellow-brown color and thicken and separate from the nail bed. Infections in general, diabetics are more prone to infections, which tend to be more serious than those in non-diabetics. Simple bladder infections are increased, but also the more serious kidney infection, which is called pyelonephritis. This is increased 4 to 5 times in diabetics and tends to involve both kidneys. Complications such as abscess formation and renal papillary necrosis, which necrosis means death, are also more common in diabetics. All types of fungal infections are more common in diabetics. That includes oral thrush, vulvovaginal yeast infections, fungal infections of the nail, and athlete's foot. Foot infections are quite rare, except in diabetics, and then they are pretty frequent. And they often tend to hospitalization, amputation, and long-term disability. These infections can involve multiple different microorganisms, making broad-spectrum antibiotic treatment necessary. And you know, we're developing, we have the bacteria and the viruses are much smarter than we are, and their growth and their enhancement has caused there to be there's some bacteria that is resistant to all antibacterials known to man. So that's why you have those broad spectrum ones, because it'll treat everything that we know of, but it's all dangerous. And then despite adequate glucose control, 15% of diabetic patients will develop non-healing wounds during their lifetime. Diabetics have a 15-fold increased risk of lower limb amputation and account for over 50% of the amputations done in the United States. The financial cost of these diabetic foot problems cannot be underestimated as well. It is estimated that each case costs upward of $25,000 to treat. And now we have a wound center. Why do we have a wound center? Because we have these non-healing wounds because of diabetics or people that have peripheral vascular disease and don't get the blood flow to their legs the way they need to. And some of the other ones are erectile dysfunction. Aging males 39 to 70 have found that the prevalence of impotence ranges 10 to 50%, and diabetes is a key factor for a lot of these guys. Blood pressure medicine can also cause erectile dysfunction. Erectile dysfunction affects diabetics at a younger age than non-diabetics. Then we have fatty liver disease, and that is the storage and accumulation of excess fat in the form of triglycerides exceeding 5% of the total liver. When this fat damage causes damage to the liver tissue, it's called non-alcoholic steatohepatitis, or NASH, and that's it is one of the leading causes of liver cirrhosis. And last, there's some showing that Alzheimer's disease is increased with people with diabetes, and there's polycystic ovarian syndrome, which causes women to not, it's characterized by irregular menstrual cycles, evidence of excessive testosterone, and ultrasound finding of cysts on your ovaries. This can cause a problem with becoming pregnant and having children. So, and it also, most of those patients have a weight problem and they just can't seem to lose weight no matter what they do. All right, I didn't even get into some of the stuff that I copied to talk about, but there's always another night. So thank you so much for joining me, and we will see you next week with more of Here's to Your Good Health. Good night.